Talking about the segmental discussion of the orbital cavity, we're going to see that we have the anterior segment structures that are basically involving the structures that are lying anteriorly towards the iris, and then we have the posterior segment. So any trauma that is basically relating to the structures that are related towards the anterior segment, that would include the cornea, that is also going to include any kind of traumatic uveitis that can occur at this level. And then we have the iris injuries itself. The lens would be basically not included in this particular kind of the anterior segment trauma. It would be included in the posterior segment trauma. So all of these structures can be damaged. The corneal aberrations are again a very common traumatology that is seen over here. Now, when we say that there is a corneal aberration, usually the picture is quite devastating. The person would give you a history of extreme irritation, extreme redness in his eyes, and that is basically going to correlate towards some sort of a corneal ulceration or corneal aberration. Now, to diagnose a corneal aberration, it's again very important to perform the fluorescein staining in this particular case, because this is the only way that we'd be able to see that if any kind of a trauma has occurred to the cornea or not. So corneal replacement surgeries are again quite commonly performed nowadays. And then we'll be moving on to the other segmental structures of the eye, which can be damaged in any particular case of the anterior segment trauma of the eye. Usually, we're going to focus on the anterior segment of the eye. Why is that so? Because that is the most prone area that can be damaged by any impact. It can be any blunt weapon causing such injuries. It can be any sharp weapon that can result in these particular kind of injuries. And then we have the chemical injuries on the other hand, and the most prone area which is basically relating to this kind of an vitrolage injuries, that is basically the acid throwing phenomena, is the anterior segment of the eye. All of these structures, that is the conjunctiva, the sclera, the cornea, the anterior segment, the uveal structures, they are mostly damaged in this particular case. So the victims are usually advised to wash the eyes thoroughly off to get rid of any acidic content over there, and then you're going to apply topically a lot of antibiotics and steroids for this particular case of vitrolage that we usually come across, and that is again a very important case for medical emergencies. So over here in this particular section, we'll be focusing on the assessment of such patients, as well as whenever we see such patients of the anterior segment traumatology, how are we going to take the history from the patient? Because it's very important to analyze at this point that what was the kind of weapon used for this formation of particular injury. The blunt weapon has its own consequences. Sharp weapon is treated separately, and the chemical injuries are going to be dealt in separately. So it's again very important to look into the case very carefully and to get the assessment in a very accurate and a correct manner. History taking, usually if the patient is found unconscious, you can take the parallel history from the patient's relatives or even the close family members or whoever people brought him or her to the hospital or to the emergency department. The examination of the eye is very important because you're going to first of all inspect the external structures in this particular case of eye examination, and then you're going to move on to the palpation phenomena, in which obviously you're going to see or you're going to rule out the rims of the orbital cavity, that is the medial and the lateral walls, the roof and the floor of the orbital cavity. On the other hand, the zygomatic arch is also involved in the tribord fractures. So you're gonna basically line out all of these rims of the orbital cavity as well as the zygomatic arch to evaluate whether the person has some sort of orbital fractures or not. And then the causative factors of the anterior segment of the eye. Traumatology of the anterior segment of the eye. So the causative factors can be, as we've already discussed, it can be a range of traumatology or a range of weapons that basically cause this particular kind of injury in this particular kind of person or in this particular kind of patient. We'll be dealing with these causative factors. We should have this differential diagnosis in our mind just to get to the definitive diagnosis in a systematic manner. So over here, we're going to focus on all of these facts. The assessment would start right away from the history taking, obviously, whenever we start off with the assessment of any traumatic case. We start off with the history, complete detailed history, starting off with the patient particulars, the causative agents, then the age, the gender of the patient, the occupation of the patient is very important, because that is sometimes related to the kind of trauma that has occurred to the patient. The history is very important, and the past medical history is very important. The past medical and surgical history. If the patient has undergone some sort of surgeries in the recent past, that is very important to evaluate at this level. The forces that are involved. Forces would be classified as blunt, sharp, and the chemical injuries that are involved in a particular case. If known, they are to be documented in detail over here. Blunt foreign body injuries, and in case of sharp injuries, we have the perforating and the penetrating kind of injuries that will be categorized right away over here. Then we have the chemical injuries, cases of vitrillage we have already discussed, and then we have the occupational kind of chemical injuries. Working in any kind of severe chemical factories or industries can result in a lot of traumatic cases in a particular patient. Acid throwing is very important, alkali throwing is very important, and the contact allergies. So the chemical throwing is usually the most common cases that we usually encounter in the medical emergencies, and on the other hand, we can have the contact allergies that can result due to the chemical injuries in a patient. The common causes would include the abrasions. Abrasions are usually caused by the blunt weapons. The minor trauma, it's usually a very minor trauma. The lashes are usually involved. The fingers can be involved. Usually the patient is suffering from a lot of lashes phenomena, or it can be all of this blepharitis phenomena can even result in this particular case. Recurrent epithelial erosion syndrome is one of the condition which can make the person more prone to the development of injuries to the cornea, and it can be an abrasive kind of injuries. Then plants, sometimes thorny plants even can result in some types of the abrasive injuries in a patient. Foreign bodies are sometimes seen. Grinding phenomena is usually seen in cases of the foreign body inclusions in the eye or in the orbit. These foreign bodies can again be divided into the penetrating type, sharp weapons, and then we have the blunt weapons on the other hand. The penetrating injuries can be the hammering a metal on metal, and then we have the explosions that are again going to result into the penetrating kind of injuries in a patient. Road traffic accidents, then we can further classify these penetrating injuries into dirty injuries or clean injuries. So it's depending upon the case, how do we classify them. The blunt injuries usually result from the fists during the street brawls. Then we have the ball injuries. Sporty injuries are very commonly seen in a lot of cases, and bungee cord injuries are one of the causative factors for the blunt injuries that are occurring towards the eye or towards the anterior segment of the eye. Examination would particularly include the visual acuity of a person first of all, and that would be basically, it can be the skin and the lids have to be evaluated in this particular case. Eversion of the lids is very important. Visual acuity is performed in that particular kind of manner in which we have asked the patient to read out the Snellen's chart, and accordingly we are going to record the visual acuity in this particular case. The skin and the lids are going to be inspected in detail, and then we're going to look for signs of the severity, and then we're also going to evidence that the mechanism of injury, how it occurred. We're going to basically evaluate this by inspecting the skin and lids in detail. Then the eversion of the lens is also very important. Subtarsal foreign bodies are found. Look for the fine scratches on the upper cornea as well over here. The conjunctiva is going to be dealt in with detail. Lacerations are basically the jagged form of the blunt injuries that usually occur. It can occur in the eyelids, it can occur in the conjunctivas. Look carefully for the scleral injuries beneath. And subconjunctival hemorrhages usually give a very terrifying picture, but that's usually a very self-limiting kind of a condition. Only reassurance is needed in this particular case of subconjunctival hemorrhages in a patient. eversion of lens, eversion of eyelids is very important just to see whether the patient is suffering from some sort of foreign body inclusions or not. So we're going to evaluate this. The examination has to be done in very detail. This picture is basically giving you the way to evert the eyelids and completely examine the eyeball or completely examine the orbital cavity. The examination again of the cornea would be by the fluorescein staining, because of the fact that any abrasion or any wound towards the cornea can only be detected through this fluorescein staining phenomena, as it's a transparent structure. The leak or the infiltrate has to be looked for, and the foreign bodies has to be investigated in this particular case of corneal trauma. On the other hand, we have the anterior chambers as well. We have these cellular structures that are seen in this particular case, and then we have the hyphema. How do you define hyphema? It's basically the collection of blood in the anterior segment, and due to the gravity, this pool of blood is collected usually in the inferior segment of the cornea. So the hypopion is, again, if there is some infectious state along with the hyphema, along with the collection of the blood, then we are going to see this whitish discharge that is collected at the base of the anterior chamber. So this is the difference between hyphema and how we differentiate hypopion from hyphema in this particular case of anterior chamber trauma. It's usually on the slit lamp examination that we evaluate the changes in the cornea, and these particular changes, the hyphema, the hypopion, all of this can be evaluated over here when we perform a complete detailed slit lamp examination in this particular patient. The iris, if it is examined in detail, what are the things that you're going to look for? This is basically the iris, as you can see over here, and these are some of the defects that we can observe in the iris. Obviously, it's going to be upon the slit lamp examination. The trans illumination defects are very important over here. Then any distortion of the iris is again very important. The peaked pupils, the dilated pupils, mydriasis, with what we call mydriasis or an abnormal mydriasis in a patient, and checked for the reflexes is again very important. The pupillary defects have to be detected over here by the RAPDs. The lens defects are very important. The lens subluxation can be noted at this level. Red reflex, if it is absent, it is going to indicate the cataract in the particular patient. Stability of the lens is very important, because if it's subluxated, it's not going to be stable, or it is not going to be found in the particular place around the iris. Then we have the intraocular pressure. So if the intraocular pressure is raised, it is going to point out towards any sort of uveitis or the problems with the uveal chamber. It can be increased as well as it can be decreased. The normal intraocular pressure is almost around 20 millimeters of mercury. So any rise, or if it is below this particular level of intraocular pressure, it has to be noted. This is a kind of iris trauma, as you can see. This is an abnormal mydriasis that is noted down. The dilation of the pupil is quite easily noted down in case of the iris trauma. Then we have the corneal foreign bodies that can be seen over here. So it's very easy to diagnose these corneal foreign bodies. Usually you're going to perform the slit lamp examination, and performing the complete detail examination would reveal a lot of factors. The grinding is the most common cause. Usually do not need the surgery. The treatment would include the removal of the foreign body with needle or burr, and the children may require a general anesthesia in this particular case. So usually the treatment would include the evaluation or the excursion of the foreign body through the burr, through the needle, and usually it is performed in the local anesthesias, but in particular cases you can also perform the general anesthesias in these cases. Then we have the corneal abrasions. As we've already discussed, the corneal abrasions can only be evaluated through the fluorescein staining, as it is a transparent structure. So a damaged cornea has to be evaluated in a particular way. It is very common, usually resolves quickly, very painful initially. So the patient, apparently you would find no finding except when you perform the fluorescein staining. And before the diagnosis, the patient would be already giving you a history of very painful condition. The treatment would include to exclude any other injuries in this patient, and then the chloramphenicol ointment is usually prescribed in these particular kind of patients. A patch is placed for 24 hours just to give a complete rest to the patient, and pain relief can be given to the patient. Sleeping tablets, if the pain is something that is not quite easily absorbed by the person, then you can basically prescribe pain relief tablets as well as the sleeping tablets to the patient for the relief. So over here in this section, we particularly focused on the anterior chamber and what are the structures in the anterior chamber, including the cornea, including the iris, and including the uveal structures. So all of these can be damaged and all of these can be exposed to the different kinds of traumatic conditions. What are the complications that are relating to it, the clinical features, as well as the treatment modalities for such cases are discussed over here. So that is the end of this section. Thank you for watching sqadia.com.